Good afternoon, ladies and gentlemen, and thank you for joining today's webinar on the Affordable Care Act and what the healthcare law means for small businesses. My name is Xiomara Pena, and I am the Southern California Outreach Coordinator here with Small Business Majority, and we are pleased to be presenting this ongoing series with our partners at Centers for Medicare and Medicaid Services and the Small Business Administration. I'm happy to be joined by representatives from each of these organizations, having Meredith from the SBA and Laura from CMS, who will be delivering the presentation today. Now, before we get started, however, I do have a couple of quick housekeeping announcements. First, I'd like to note that this call is off the record and not for press purposes. If you are a member of the press and you'd like to speak to someone about the Affordable Care Act, please respond to any of the emails that you have received about today's presentation, and you will be connected with an expert. And second, we will be sharing the slides that form the basis of today's presentation via email following the presentation, so keep an eye out on your inbox for that email. Also included in that email will be the registration link for the next few webinars on this topic. This is part of an ongoing series that we will present this information every Thursday at 2 o'clock Eastern Time. Now, if you'd like to hear the program again or know someone who would benefit, please feel free to share the registration link. And finally, we will be taking questions throughout the presentation today, and we'll answer as many as possible at the end of the webinar. Please enter your questions in the chat box that is located in the lower left-hand corner of your screen. And with that, I'd like to turn it over to Meredith at the SBA. Meredith?
Thank you so much, Xiomara, and thanks to Small Business Majority for being such a great partner in this education effort that the SBA and the Centers for Medicare and Medicaid Services have engaged in over the last few years. Really, our goal is to make sure that you as small employers and those of you working as advisors to small employers understand what the healthcare law means for small business owners. And so today's presentation will cover some top highline points about kind of major provisions of the law that small employers will want to know more about, and we'll direct you to resources at the end to get additional information about other provisions as well as a deeper dive on some of the things that we cover today. We are providing this information for your informational purposes only and not as tax or legal advice. We encourage you to reach out to your trusted advisors to figure out how this information relates to your own unique business circumstances. As Xiomara mentioned, I'm with the Small Business Administration. I'm a senior advisor to the SBA administrator, and we have partnered with our other federal partners like the Centers for Medicare and Medicaid Services as well as Treasury and IRS to make sure that we get information into the hands of small business owners that's timely and accurate so that you can make decisions on your end about some of the benefits of the Affordable Care Act and some of the ways in which it may impact you as business owners. So with that, a short roadmap for today's presentation. We're going to cover three main topics. First, the Small Business Healthcare Tax Credit. I'll then turn it over to my colleague Laura Eldon at CMS to talk about the marketplace, both for small employers, known as the SHOP marketplace, as well as self-employed business owners with no employees who have opportunities through the individual side of the marketplace to purchase coverage. Third, we'll cover the employer shared responsibility provisions, also sometimes known as the employer mandate. Those only apply if you're a business with 50 or more employees. And then finally, as I said, we'll mention some additional resources and a few other provisions that you'll want to be aware of. And again, we'll take questions through the chat feature all throughout the presentation, and then we will try to answer as many as we can in about the last 10 minutes. So we'll have roughly 45 minutes or so of presentation, and then we'll take the questions on in the last 10 minutes. And with that, we'll go ahead and get started. So before I dive into the first main topic, I did want to set the frame a little bit around what the small business marketplace for healthcare looked like before the Affordable Care Act was passed in 2010. So for those of you that wanted to cover your workers, were looking to provide coverage, there were a lot of obstacles. So fewer choices in the small group market, higher premiums and unpredictable rate hikes, higher rates for groups with women and older workers, those with chronic health conditions, often no coverage at all, or longer waiting periods for folks with pre-existing conditions. When the Affordable Care Act was passed, there were several market reforms that directly impacted and benefited the small group market. So, for example, under the Affordable Care Act, insurance companies face limits on administrative spending, and what that means is insurance companies have to spend at least 80% of consumer dollars on providing medical care rather than using those funds for overhead costs or salaries or other administrative costs. Second, insurance companies under the ACA must now disclose and justify any rate hikes of 10% or more through a process called rate review. Third, insurance companies can no longer charge higher rates or deny coverage because of pre-existing conditions. And they also can't charge higher rates based on gender. There are limits on charging additional premiums for older employees. So all of that was part of a bundle of reforms that came into effect under the ACA. And then additionally, all plans that are offered in the small group market that were not grandfathered in must provide a core set of essential health benefits, and that was true starting plan years on or after January 1st of 2014. So essential health benefits are things like emergency services, prescription drug coverage, lab services, preventive and wellness services, maternity and newborn care. So again, it's a core set of about 10 benefits or so that must be included in small group market plans that aren't grandfathered in. And then this slide I won't cover in a lot of detail, but it just provides the bigger picture around the Affordable Care Act, some of the additional market reforms. As many folks well know now, young adults can be covered on their parents' plan until their 26th birthday. Children can't be denied coverage due to pre-existing conditions, and that is true across the board now for adults, and some savings for prescription drug benefits and seniors. So feel free to come back to this slide at your convenience. I just wanted to provide the bigger context around the Affordable Care Act. And so now let's move into our main topics for today, and keep in mind that as we're talking about things like the tax credit and the marketplace, one of the threshold questions is the size of the business, because often the size of your business is going to determine whether or not you can take advantage of some of these benefits and whether some of these provisions may apply to you. So first, the Small Business Health Care Tax Credit. This is a credit that's been available to both for-profit and nonprofit employers since the law was passed, since 2010. And it is a tax credit that's available to smaller employers with low to moderate income wage workers. So there are 3 eligibility criteria. The first is a size standard. First, you must be an employer with 24 or fewer full-time equivalent employees. We'll look at what full-time equivalent means in just a moment. So that's the first eligibility criteria. Second, you must have average annual wages of your employees below $50,000. And then third, you as the employer must contribute at least 50% towards your employees' self-only premium costs. So just to recap, 24 or fewer employees for the business, average annual wages below $50,000, and that's indexed annually for inflation. And then third, contribute a uniform 50% or more toward single coverage. So what does it mean to have a full-time equivalent, or what is a full-time equivalent? It's basically a combination of employees who collectively equal one full-time employee. And so for the purposes of the tax credit, the full-time definition is 40 hours per week, so it would be a combination of folks. For example, 2 employees working 20 hours a week would equal a full-time equivalent. So you're adding together all of your employees based on their hours, and if you have 24 or fewer, then you meet that size standard. And then secondly, for average annual wages, you're adding up all the wages you paid to your employee during the tax year, including overtime pay, and dividing the total wages by your number of full-time equivalents, and then you're rounding down to the nearest 1,000. So, let's say you pay total wages for a given tax year of $200,000 and you have 10 full-time equivalents. Your average annual wage would be $20,000. You're well below the threshold, and you would meet that standard. And then the premium contribution, the requirement that an employer pay at least 50% of self-only coverage does not apply to dependent coverage, so you can pay less than 50% of dependent coverage premiums, but still include those premiums in the credit calculation. And then finally, the note on the bottom, the credit works on a sliding scale, and what that means is the smaller your business or charity, the larger the credit is to you. So if you have 10 or fewer full-time equivalent employees and average annual wages of less than $25,000, the maximum credit is available to that category of employer. So those are the three eligibility criteria. Now let's look at how the credit works. In the early years, it was a credit that was worth up to 35% of a small employer's premium contributions, 25% for tax-exempt employers, and that early iteration of the credit was available through tax year 2013. And then starting with tax year 2014, the credit went up to 50%, and the additional requirement starting in 2014 is that in order to claim the credit, you as the employer need to offer coverage to your employees through the SHOP marketplace. So that was the additional requirement starting in 2014 when the credit rose. And we'll talk about SHOP in just a moment so you can see how it interplays with the tax credit. For 2014 tax years and beyond, if you're eligible for the credit, you can claim it for 2 consecutive taxable years. And that's true whether you took it starting in 2014 or in a later year. It just has to be 2 consecutive years that you claim the credit. The good news is there is a tax credit calculator that employers can use to figure all of this out, both, do you meet the eligibility criteria and how much the credit might be worth. That's the tax credit estimator located at healthcare.gov, and we've got the link up on this slide. For tax-exempt employers, the credit is refundable. So even if you have no taxable income, you may be eligible to receive the credit as a refund, so long as it doesn't exceed your income tax withholding and your Medicare tax liability. So this slide again just recaps the eligibility criteria. And one thing that I didn't mention with the number of employees and average annual wages is that you're not going to take into account the owners of the business for the purposes of either the size standard or the average annual wages, and you're not counting family members, so spouses and family members, so children, grandchildren, parents, step-parents, mother-in-law, brother-in-law, etc. All those folks, extended family, aren't going to count toward your size or your average annual wage. So that's something to flag as well if you're thinking about whether you might be eligible for the tax credit. And now we're going to move into the second main topic for today, the new marketplace, known as SHOP for Small Employers, which stands for the Small Business Health Options Program. With that, I will turn it to Laura Eldon with the Centers for Medicare and Medicaid Services.
Great. Thanks, Meredith. And thanks, everyone, for joining us today. And again, to the Small Business Majority for being such a great partner in hosting these webinars. So as Meredith mentioned, this portion of the presentation will provide an overview of the SHOP marketplace and the application and enrollment process for 2015. We're going to focus on the SHOP marketplace that is run by the federal government, which is also known as the Federally Facilitated SHOP Marketplace, but also as the FF SHOP. States that are running their own SHOP marketplace may operate a little bit differently. So if you're unsure whether your state uses the federally facilitated SHOP or if it runs its own SHOP marketplace, please visit healthcare.gov for more information. So what is the SHOP marketplace? The Small Business Health Options Program, which is also known as the SHOP marketplace, is part of the new health insurance marketplaces, which are also referred to as an exchange. And there is a SHOP available in every state. The shops were created in order to make it easier for small employers to find and purchase health insurance for their employees. The shop is currently open to employers with 1 to 50 employees, and that's including nonprofit and religious organizations. The shop marketplace offers a choice of health and dental plans and tools to help consumers make informed purchasing decisions. Employers and employees can submit initial group enrollments for shop coverage at any time throughout the year, but once the initial group enrollment is submitted and the coverage goes into effect, the shop enrollment is limited to an annual enrollment period for employees, also special employees and enrollment periods for newly eligible employees. And in addition, if employers offer their employees coverage through the shop and they meet other eligibility requirements, as Meredith discussed a little bit earlier, small employers may be able to claim the small business healthcare tax credit, which can be worth up to 50% of their premium contributions. Together, new insurance reforms and the shop will help to curb premium growth and spur competition that's based on price and quality. And small employers can enroll in coverage in the shop marketplace online through healthcare.gov. Currently, 14 of the 33 states that are operating off the federally facilitated shop marketplace, small employers in those states have the option to offer their employees a choice of health plans, much like large employers do. And that's called Employee Choice, and that should be available in all states come 2016. But just as a reminder, small employers with fewer than 50 full-time equivalent employees are not required to offer their employees health insurance, and there's no penalty if they choose not to. So this next slide focuses a little bit more on who can purchase shop marketplace coverage and when. So as I've said, the shop marketplace is open currently to small employers with 1 to 50 full-time equivalent employees, or FTEs. Part-time workers whose combined hours total at least 30 hours per week are also included when determining FF shop eligibility. Employers must have at least one employee on payroll who is not a business partner or spouse to be eligible for shop marketplace coverage. Also, to participate in the federally facilitated shop, small employers must offer coverage to all of their employees who work an average of 30 or more hours per week. Healthcare.gov offers an online tool, also called the Shop FTE Calculator, that can help employers count how many full-time equivalent employees they have to help them determine if they might be eligible for the shop marketplace. And once again, full-time equivalent employees are generally those who work at least 13 hours per week. The FTE calculator is currently based on the counting method that is used by the shop marketplace that's operated by the federal government. And until 2016, that counting method may differ from the method used by states that are running their own shop marketplaces. Employers in a state with a state-based shop should contact the shop in their state to learn more about their employee counting methods. As I said earlier, also small employers can offer their employees health coverage through the FF shop now or at any time throughout the year. Although in the FF shop, if an employer's group initial enrollment is completed between the 1st and the 15th day of the month, coverage could begin as soon as the first day of the next month. So for example, if the initial group enrollment is completed on March 10th, group coverage could begin as soon as April 1st. And for initial group enrollments that are completed after the 15th of the month, coverage could begin as soon as the first day of the second following month. So for an enrollment that's completed on March 18th, group coverage could begin as soon as May 1st. So this next slide focuses a little bit more on the requirements to actually participate in the shop marketplace. So before employees can complete an enrollment in the shop marketplace, the employer will generally need to meet the shop's minimum participation rate for their state. States and issuers may also set different requirements for group plans that are offered outside the shop. And in many states that are using the federally facilitated shop, at least 70% of the businesses or groups' employees who are offered coverage must accept that offer before any of the employees can enroll. And in a few states, the FF shop has set a different minimum participation rate. So interested employers should check on healthcare.gov to find out if their state is one of these exceptions. And the employer's participation rate is determined by taking the number of employees who are enrolling in coverage offered through the SHOP and dividing it by the total number of employees who are offered coverage. And not every employee is counted for the purposes of determining the participation rate, such as employees with group coverage through another job, another person's employer health plan, or through government-sponsored coverage, such as Medicare, Medicaid, the VA, Indian Health Service, or TRICARE. Employees' dependents also are not counted in determining the participation rate. I will note that the criteria for meeting the minimum participation rate will change for the 2016 plan year, so it will be a little bit easier for employers to meet the minimum participation rate through the SHOP. Any employee who is currently enrolled for 2016, if an employee is enrolled in minimum essential coverage, they'll be counted towards the employer's minimum participation rate. And employers don't need to calculate the minimum participation rate themselves because the SHOP enrollment application will do this for them and determine whether the employer has met the minimum participation requirement. And all of that is based on the information that's provided by the employees when they accept or waive the employer's offer of coverage. But there is an exception to these minimum participation requirements. From November 15th through December 15th of each year, employers can buy small group coverage inside or outside of the SHOP marketplace without having to meet any applicable minimum participation rate. So if an employer is still interested in SHOP, but they're having a hard time meeting the 70% requirement, we recommend that they enroll during that time because the 70% requirement does not apply for that 1 month window. So before employers can begin their SHOP application, they can also kind of get a look at the price estimates for all of the 2015 qualified health plans and qualified dental plans that the federally facilitated SHOP offers in their area by using an online premium estimation tool. To use the tool, users will just have to answer a few quick questions, such as whether they're looking for health benefits or dental benefits, and they'll also have to select the state where their primary business address is located. The price estimates are based on the age ranges of employees and where the business is located. And the estimates reflect prices for people who don't use tobacco. Insurers are allowed to charge higher premiums for tobacco users. Agents, brokers, or navigators can also help employers use the tool and make plan comparisons. And employers can go on to healthcare.gov at any time and get a quote for their 2015 coverage as part of their enrollment process. But it is important to note that neither the price estimates on healthcare.gov nor the final quote will reflect any savings that the employer might be eligible to receive through the small business healthcare tax credit after they file their tax returns. So now we're going to cover some of the options for self-employed individuals. Sole proprietors or shareholders of more than 2% of an S corporation that has no common law employees can't buy health insurance through the SHOP marketplace. But small employers and spouses may qualify to buy insurance through the health insurance marketplace for individuals and families. And also, depending on the level of household income, as individuals, sole proprietors may qualify for tax credits through the health insurance marketplaces. And while employers can complete an initial group enrollment at any time during the year, individuals that are using the health insurance marketplace for individuals and families generally must enroll during the open enrollment period. For 2015, the open enrollment period has closed, but the 2016 open enrollment period will begin again on November 1st and go through to January 31st. Outside of open enrollment, however, sole proprietors, the self-employed, and their families may be eligible for a special enrollment period in the health insurance marketplace if there is a change in their life situation, also known as a qualifying life event, and in certain other limited circumstances. Examples of qualifying life events include moving to a new state, certain changes in income, and changes in family status or size, like if they're getting married, getting divorced, or having a baby. And we encourage you to visit healthcare.gov for more information on premium assistance, enrollment, and qualifying life events. So there are some new features for the SHOP for 2015. Small employers can now access the shop online through healthcare.gov, where they can browse, select, and offer employees health and dental coverage that begins in 2015. They can also have employees enroll in shop coverage online, and employers may also find and authorize a shop-registered agent or broker to help them with their online enrollment. Paper applications for shop marketplace coverage are no longer distributed or accepted, and shop-registered agents and brokers can access new online features and manage accounts when they're authorized by clients. And employers in 14 of the federally facilitated shop marketplace states can offer employees a choice of plans within a single plan category. And the shop call center is also now available to assist employees as well as employers, agents, and brokers. So I've mentioned this term employee choice a few times throughout the presentation, so now we're going to focus a little bit more on what employee choice actually means. So the ultimate goal of the shop marketplace is to give small employers more options for their employees, and that's including the option to offer employees a choice among health plans in one plan category. In 2014, small employers in states with a federally facilitated shop generally had a choice of health plans and dental plans in different plan categories from various health insurance companies. The employers could select to offer the employees only one shop-qualified health plan and, if applicable, a single shop-qualified dental plan. Some states, however, who were running their own shop marketplaces gave the employers the ability to offer their employees a choice of plans in 2014. However, in 2015, for plans that are currently taking effect, employers in 14 states that are operating on the federal shop marketplace platform are able to offer employees a choice of health plans. So that means that the employer will select a plan category, and then the employee can enroll in any plan that's available within that category. And many states who are running their own shops already offer employee choice options, and they may also differ from the employee choice option that's currently offered by the federally facilitated shop marketplace. However, in 2016, all states are expected to offer small employers a choice between offering employees a single shop plan or letting employees select among multiple shop plans. So just a little bit more about employee choice. So offering employees a choice of health plans and dental plans can provide advantages for both the employer and the employee. Employee choice can mean less hassle for the employers because they don't have to spend as much time trying to find one plan that fits the needs of all of their employees. It also means that employees can select the plan that works best for their individual needs. And offering employees a choice of health plans, as many large employers do, can help a small business attract and retain valued employees. And when the employees can choose their own plan, the insurers have to compete for their business, which can lead to lower costs and better service. And with the shop marketplace, more choice comes with less paperwork. No matter how many different insurance companies or plans and the employees select, the employer gets and pays just one monthly bill, and the shop takes care of dispersing all of the payments. So the employees get choice, but the employer gets to set basic limits by deciding which category of plans to offer and how much to contribute to premium costs. So this next slide lists out all of the states that are currently using the federally facilitated shop platform and those that are highlighted currently offer employee choice in 2015. So in the states that are using the FF shop and also offering employee choice, the employers can offer their employees a choice among all qualified health plans in a single plan category that the employer selects. And if applicable, the employer can also offer their employees a choice among all dental plans within a single plan category that the employer selects. And in any state that's using the FF shop, an employer can still choose to offer employees a single qualified plan and, if applicable, a single dental plan if the employer prefers that. And just to wrap up, the shop marketplace offers many ways to get help. We do have a toll-free shop call center that is available to assist employers, agents, brokers, and also now employees who are enrolling in employer offer response shop coverage. Employers who create an online account in the shop marketplace on healthcare.gov can find a shop registered local agent or broker online, and they can authorize that agent or broker to assist with their enrollment and manage their account online as well. Employers can use the Find Local Help feature on healthcare.gov to help them locate a SHOP registered agent or broker if they're not currently working with one. And they may also find other assisters in their area through Find Local Help. And this can be done without having to create a healthcare.gov account. The employer will just need to enter their city and state or their zip code and select the Small Business Health Options box. But employers who do want to work with an agent or broker they found through Find Local Help should just ask that agent or broker if he or she has registered with the SHOP Marketplace and completed a SHOP Marketplace profile. Only agents and brokers who have taken those steps can complete an application for the employer. Sole proprietors, the self-employed, and those with no employees and those assisting them can call the health insurance marketplace for individuals and families. And that call center is open 24/7 except for certain holidays. So with that, I'll turn it back over to Meredith to go over some of the employer shared responsibility requirements.
Thanks, Laura. So now we'll cover the third and final main topic for today, employer shared responsibility. As Laura mentioned when we were talking about the marketplace, if you're an employer with fewer than 50 full-time, including full-time equivalent employees, then you're not required to provide coverage to your employees, and there's no penalty if you choose not to. The rules that govern that are called the employer shared responsibility rules. So we want to cover them in some detail so you better understand, how you figure out if you have 50 or more employees or you're below that threshold, and then if you're above, if you have 50 or more, how do the shared responsibility payments work? How does the IRS assess them? So that's the focus of this third and final main topic. So employer shared responsibility, again, only applies if you have 50 or more full-time employees, including full-time equivalents. And for this tax year, for 2015, there's an additional layer of what's called transition relief, and that says that if you're on the smaller end of employers that are covered by these rules, you have between 50 and 99 full-time, including full-time equivalent employees, then you have another year until 2016 before these rules apply to you. So if you're below the threshold, these rules don't apply. You're not required to provide coverage. You won't be penalized if you don't. But if you have 50 or more, then you have a choice between offering coverage to your full-time folks that meets certain standards or making a payment to the IRS if you don't do that. So that's what we'll look at in the next several slides. And just to give you some stats around this, so about 96% of firms in the U.S. are below 50 employees. So that means only about 4% of firms are covered and impacted by the employer shared responsibility provisions. Okay, so first, how do you figure out if you have 50 or more employees and therefore are covered by shared responsibility? The first thing to know is the definition of full-time. So under the employer shared responsibility provisions, similar to the standard we looked at with the SHOP Marketplace, full-time employee means an employee who is working on average 30 hours or more per week. Note that that's different than the definition of full-time that's used for the tax credit. For the tax credit, full-time is 40 hours per week. So there is a difference in these provisions, and we just want to make sure that folks are clear about that. So a full-time equivalent, for the purposes of these rules, means a combination of employees who collectively equal 30 hours per week or more. So if two employees, for example, are working 15 hours a week, together they'd equal a full-time equivalent under the employer shared responsibility provisions. The other thing to know when you're trying to figure out if you have 50 or more employees is that the IRS's controlled group rules apply. And what those are long-standing IRS provisions. They're not unique to the Affordable Care Act, but they basically say that employers who are under common control are going to add their employees together to figure out whether they meet the threshold of 50 or more. And so if, company A and B are part of the same control group and individually they don't have 50 employees but collectively they do, then both employers would be subject to the shared responsibility requirements. So as one example that the IRS provides on its website, let's say an individual owns 80% or more of two businesses that are separate legal entities, the total number of full-time employees, including full-time equivalents of that employer, would be combined together. So even though company A and B are separate legal entities, because the same individual owns 80% of both, companies A and B would be combined for the purposes of their number of employees. And if together they have 50 or more, then both companies would be subject to shared responsibility. That being said, compliance with the actual requirements of these provisions and any payments that might be assessed against the employer are generally going to be assessed on a firm-by-firm basis. So even if you're part of a control group and that means that you're subject to shared responsibility because of the number of your employees collectively, each company is still going to have separate compliance requirements, and the payments that could be associated will be assessed on a firm-by-firm basis. So the next thing we're going to look at is how the rules work. So you've determined you have 50 or more employees, or for this tax year 100 or more, since those with 50 to 99 employees are exempt until 2016. There are two potential scenarios in which an employer who's covered by these rules may owe what's called a shared responsibility payment. So we're going to outline those two scenarios on this slide and then break it down in the next few slides. So the two scenarios are either the employer doesn't offer coverage to at least 95% of its full-time employees and their dependents, or the second scenario is that the coverage the employer offers to its full-time employees isn't affordable or doesn't provide minimum value, or a particular full-time employee wasn't offered coverage. So if one of those two scenarios is true and at least one full-time employee receives a premium tax credit in the individual marketplace, so the marketplace that we've been talking about, then the employer may owe a shared responsibility payment. So I know that's a lot and it's kind of convoluted, so we're gonna break it out further in the next few slides. The one thing I will note, though, for this slide is that for 2015, that requirement to offer coverage to at least 95% of full-time employees is a slightly lesser requirement of 70% for 2015 only. Okay, so let's talk about some of these key definitions for these two scenarios. So I mentioned, and I'll just flip back, one of the two scenarios, number 2, is the case where the employer does offer coverage to its full-time employees, but the coverage being offered isn't affordable or it doesn't provide minimum value. And that may result in an assessable payment if that's the case. And so those definitions are outlined on this slide. So when we say providing minimum value coverage, what that means is that the plan that the employer is offering covers at least, on average, 60% of the total costs, meaning your employee's share is 40% or less. That would be considered a plan that provides minimum value to an employee. And then affordability, there's a statutory definition, and then there are what are called safe harbors or alternative methods that the IRS has said employers can use to make sure that the plan they're offering is affordable. So the statutory definition of affordability is based on household income. And what it says is the coverage that you offer to your employees would be considered unaffordable under these rules if the full-time employee share of the lowest cost single coverage or self-only coverage is more than 9.5% of that employee's household income. That would not be considered affordable under these rules. Recognizing that employers may not know household income or have access to that information, the IRS, through the regulatory process, developed 3 safe harbors. They're just alternative methods that the IRS has said an employer can use and rely on to meet the affordability test. So one of those safe harbors is outlined on this slide on the right-hand side, and it's based on the W-2 wages. So if the cost to the employee of a self-only plan is no more than 9.5% of his or her wages on the W-2, it would be deemed affordable. You would be offering an affordable plan under these requirements. That's just one safe harbor. There's a safe harbor based on the federal poverty line and one based on rate of pay. So now let's, on this next slide, look at the two potential payments that could be owed based on the two scenarios that we've described under employer shared responsibility. So there are two potential payments an employer could owe if they fall into one of these two scenarios. So let's take the left-hand column. Again, that would be the scenario where the employer doesn't offer coverage to at least 95%, 70% in 2015 of its full-time employees and their dependents. If that's true, then a payment would apply to the employer if any full-time employee receives a premium tax credit to buy coverage in the individual marketplace. The payment owed in that scenario would be $2,000 annually multiplied by the total number of full-time employees for that employer in excess of 30. So there's an offset of 30 employees, and for 2015 in that calculation there's an offset of 80 employees. The payment is calculated separately for each month in which coverage isn't offered to a full-time employee, so the monthly breakdown is listed here, and it's based on the annual payment of $2,000 divided by 12. And again, payment is based on the employer's number of full-time employees for that month. So that's the first scenario in which a payment may be owed. And then the second scenario on the right-hand column would be where the employer does offer coverage to its full-time employees, but that coverage isn't affordable to a particular employee, or it doesn't meet the minimum value standard that we looked at. In that case, the payment works a little bit differently. The payment owed would be $3,000 per year per full-time employee who actually receives the premium tax credit. So the first scenario, the first type of payment we described, is based on all of your full-time folks. You're multiplying the annual payment times your full-time folks in excess of 30. Here, you're multiplying the $3,000 payment times only those full-time employees who receive a premium tax credit. And then finally, the payment under this scenario is capped, meaning whatever that payment amount ends up being, it can never be greater than the payment that would have been owed under the first scenario if the employer had just not offered coverage at all to its full-time folks. A couple of other key things to know, and these are based on common questions that we tend to get on employer shared responsibility. So first point, whether the employer owes a payment depends on whether it offers coverage and the quality of that coverage it offers, rather than whether the employee accepts the offer of coverage. Secondly, no employer payment is owed for part-time employees, even if they get the premium tax credit. So a part-time employee goes to the marketplace to get coverage and qualifies for a premium tax credit is not going to trigger any kind of payment for the employer. Third, it's only the receipt of the premium tax credit that triggers these payments. And that's a really important point. So if you offer coverage to your employees that's affordable and meets minimum value, that's not going to trigger a payment because they wouldn't qualify for a premium tax credit on the basis of that offer because you met the requirements of affordability and minimum value. Similarly, let's say you didn't make an offer to your employee and that employee's full-time, or you did but that offer wasn't affordable or didn't meet the minimum value tests, but that employee, instead of going to the marketplace and getting a premium tax credit, qualifying for a premium tax credit, instead that employee decides, I'm going to get covered through my spouse. That would not trigger a shared responsibility payment. So it's only the receipt of that premium tax credit that triggers one of these assessable payments. And then finally, in order not to be subject to an employer payment, employers that offer coverage to their full-time employees must also offer coverage to the dependents of those folks who are kids under the age of 26. So there's no requirement of spousal coverage. So those are the key things, the key takeaways on shared responsibility. We already mentioned the 50 to 99 full-time employee group of employers not subject to shared responsibility, generally speaking, this year. You do have to certify that you didn't reduce your employees or their hours in order to be exempt for this year, and that you maintained any previously offered health coverage. And then finally, the employer shared responsibility payments we've been talking about are not tax deductible by the employer. So quickly, related to shared responsibility, I do want to flag the new information reporting requirements. Some of you may be aware of these. There's a lot of additional information at irs.gov, but just so we can flag it for you guys, the employers who are covered by shared responsibility, so again, those with 50 or more employees, will have, along with the requirements to under shared responsibility, new reporting requirements that will go both to the IRS and to your full-time employees. And these information reports will collect basically the employer's identifying and contact information, the number of your full-time employees, and then certain information about those employees that relates to the kind of healthcare coverage you offered or didn't offer. And those reports, think of it like the W-2, they'll go to the IRS. They will also go to your employees. The first reports are due in early 2016. So if you are what's called an applicable large employer, all that means is you have 50 or more employees on average, full-time or full-time equivalent, you'll be subject to these reporting requirements. And then the other reporting requirement I wanted to flag applies to insurers, self-funded employers, and government agencies, as well as other miscellaneous providers. But for small employers, if you are an insurer as a small employer, or if you're self-funded, you'll want to be aware of these reporting requirements. Also, the first ones are due in 2016, and again, information related to the kind of coverage that's being offered. So with that, we definitely want to get into your questions, and so I'll just flag a few other quick items. Many of you are probably aware of these provisions because they've been in place for several years now, but wanted to just highlight the W-2 requirements, the notice that you need to provide to any new hires about the health insurance marketplace, and workplace wellness and additional incentives under that. So SBA has additional information on all of these provisions beyond just the ones we covered today and the ones that we didn't cover in a lot of detail toward the end at sba.gov/healthcare. We've got all the links here to the main sites we've talked about today, of course, healthcare.gov, your portal for the marketplaces, including SHOP, as well as great information for small businesses at the Small Employer tab. Then SBA's website I mentioned, we've organized content around employer size, so similar to how we approached today's webinar. The IRS website, we've got links out at healthcare.gov and sba.gov to the IRS, but if you want to head straight to that site for tax-related provisions, including shared responsibility and the new reporting requirements. And then finally, I'll just flag business.usa.gov. This is a joint venture started in 2012 by Department of Commerce and the SBA, and it aggregates resources across the federal government that are relevant to business owners. And so everything from, how do you export, to information about healthcare, to how do you just start a business. So it's a great website, definitely recommended if you haven't checked it out. That's business.usa.gov. And increasingly a lot of great resources at the local and state level, including events for business owners, as well as opportunities at your local and state level as business owners. So definitely encourage folks to check it out. And with that, we're going to take a minute, review some of the questions that have come in, and then answer as many as we can in the last 10 minutes.
Great, and thank you so much, Meredith and Laura, for presenting, and thank you to our participants for joining today's webinar. Now, as a reminder, a copy of today's slides will be available after today's presentation. We will now be moving into the question and answer portion of today's presentation. So if you do still have a question, please type them into the lower left-hand corner of your screen, and we will try to get in as many as possible. And with that, do you see any questions, Laura, you would like to answer?
Did we lose Laura, or are you on mute?
Nope, I was talking on mute. Thanks, Meredith. Okay. So just looking at a couple questions, I just wanted to flag just some general shop concepts. So as I've mentioned, the shop marketplace is open to small employers currently with 1 to 50 full-time equivalent employees. And those employers with 50 or fewer full-time employees are not required to offer their employees health coverage, and there's no penalty if they choose not to. So that's just one thing I wanted to flag. Also, there are a couple questions about what full-time versus full-time equivalent means. And the equivalent piece of that, and Meredith, please add on if I miss something, speaks to if you have, for example, 2 part-time employees, each working 15 hours a week, together they would count as 1 full-time equivalent employee in the shop marketplace.
Yeah, and I would just add, I know we tried to clarify this a few times. Unfortunately, there are different definitions under the Affordable Care Act of full-time equivalent. It really depends on what provision you're talking about. So as Laura said, with SHOP, the full-time equivalent definition is based on 30 hours a week. With employer shared responsibility, it's also based on 30 hours a week. But with the tax credit, full-time equivalent is keyed off of 40 hours per week. So just keep that in mind. But as Laura said, there's a great estimator tool for SHOP eligibility. There's also a tax estimator for the tax credit. So the good news is you don't have to figure this out on your own. You can punch in some numbers based on your workforce stats and figure out if you meet those full-time equivalent definitions.
Yeah, and both of those tools are available on healthcare.gov. You just go to the Small Businesses tab, and they should be on that page. Okay, and Meredith, do you see any, or should I keep going? Oh, I see another one. Okay, so there's a question here about when you can enroll in SHOP. So unlike the individual market, the SHOP marketplace is open all year, which means that small employers can submit their first enrollment, their initial enrollment at any time during the year. The November 1st date is important for the SHOP marketplace, as is for the individual, because that's when the 2016 plans will be available. So right now, for employers who are looking to renew their 2015 coverage, they can do that at any point during the year. They can do that now. They can wait till next month. But starting on November 1st, the 2016 plans will become available for those people who have a January 1 renewal date. Meredith, do you see any that you would like to take?
Sure. So what if you've got a tax credit in 2013, but then didn't enroll in SHOP for 2014 or 15? Can you get the credit even though the years aren't consecutive? So I know it gets a little confusing with pre-2014 versus post. The main takeaway is that in order to get the tax credit starting in 2014 tax year, you have to be enrolled in SHOP. So if you're not, even if you meet the other eligibility criteria, then unfortunately you can't take advantage of the tax credit. So the consecutive piece of it comes into play when you are enrolled in a SHOP plan, whether it's 2014 or a later year, then you'd claim the credit for 2 consecutive years, and that would be the most you could claim it for. So hopefully that clarified it. And the maximum number of years for the tax credit is 2, starting in the 2014 tax year. Where to go to get more information about the new reporting requirements for applicable large employers would definitely go to irs.gov/ACA. They've got a ton of resources. They also have a webinar series they're running this summer that does a deep dive on employer shared responsibility as well as a standalone on the information reporting requirements. But even if you don't have time for that, go to the website irs.gov/ACA. And there's a tab for employers, and then a lot of information on the reporting requirements. So let's see some of the earlier questions that came in.
I can take a couple more. So there are a couple questions in here about if it's a better benefit for these small employees for small employers to get send their employees to the individual market and providing a stipend for them to do so. So it is up to the business to decide whether or not they're going to provide health insurance coverage for their employees. But if the employers decide that they're not going to offer coverage, they can't provide a stipend or anything for their employees to go off and purchase individual coverage instead of offering group coverage through the employer. The Department of Health and Human Services issued a regulation on that earlier this year. So if you're a small employer and you're not offering coverage, you can't give your employees additional money to go out and purchase health insurance, or you can't give them a stipend that's specifically for individual health coverage. And there's another question here about an employer who purchases individual coverage. Should I have gone through the shop? So if you're just purchasing coverage for yourself and a spouse or a dependent, you should go through the health insurance marketplace for individuals and families. But if you're going to offer your employees small group coverage, then you should go through the shop. And there's another question here for employers that have not yet joined the shop marketplace. Should they wait for November 1st? So there's a couple factors that can go into that. For employers who are currently offering coverage, if their renewal date is coming up this summer, then they should enroll in shop coverage upon their renewal date. But if they don't currently offer coverage and they want to see what the 2016 plans look like, then they would need to wait for November 1st. But if you're interested in offering coverage sooner than that, then you can enroll and look at the 2015 plans and prices.
And Laura, I don't stop me please if you answered this one. Can an owner-employer receive a tax credit for the health premium? What about spouses and their dependents?
So if
I'm happy to answer it. I just wanted to make sure that we hadn't covered it already.
No, I was just I saw that question and hadn't gotten to it yet. If you want to take it, you can go ahead, but otherwise I'm happy to answer it.
That's a great question, and I think it gets confusing because we talk early on about the small business tax credits and then we throw in premium tax credits. So just to clarify, the small business healthcare tax credit is for those smaller employers with, low to moderate income employees who are offering coverage to their employees through SHOP now, starting 2014, and who are covering, at least 50% of premiums. Those employers in that profile may be eligible to get the small business healthcare tax credit if you meet the other eligibility criteria. That's separate from the tax credits that are available as individuals in the individual marketplace, and those are called premium tax credits. And what's unique about those is they can be advanced to the consumer, meaning they offset the cost of the premiums right away. So those are available to folks, if we're looking at the employer side of things. If you're self-employed with no employees and you're going to the individual market to buy coverage for yourself or a spouse, etc., you may be eligible for those tax credits. There are requirements as to who's eligible, including that you have income between 100% and 400% of federal poverty, that you not be eligible for Medicare or Medicaid, etc. But assuming you meet those criteria, you could be eligible as an individual for these premium tax credits. So hopefully that answered the difference between the small business tax credit and the what's called premium tax credit as consumers and self-employed folks.
And just to add on to that, and if I spaced, I'm sorry if you've already covered that. So there's a question here about if a business offers coverage for the employee only, can their families apply for tax credits through the individual marketplace? As long as the dependent has not received an offer of minimum essential coverage, which would be an employer as a dependent of employer-sponsored coverage, they should be able to go onto they should be able to purchase health insurance on the individual marketplace. If dependents are offered affordable coverage that is employer-sponsored and they choose not to accept it, then they're not eligible for tax credits on the individual marketplace.
Great. And then just one last question that came in. If you received the tax credit in 2013, you didn't enroll in SHOP in 14 and 15, you can't get a second-year credit for 16. No. So let me just clarify when we say 2 consecutive years. So there was sort of the first iteration of the tax credit through 2013. If you claimed that, great. You also, if you're eligible, have the opportunity to claim the credit starting in 2014 or in a later year. So in this case, you didn't enroll in 2014 and 15 in SHOP, but let's say for 2016 you enroll in SHOP. You could still be eligible if you meet the other criteria to take the tax credit, but then the 2-year minimum or 2 consecutive year rule kicks in. So you'd have to claim it in 16 and 17. You couldn't skip a year in that case. So that's when we say 2 consecutive years, it applies only for tax years 2014 and beyond. Hopefully that answered that question. So I know we're over the hour. We want to be mindful of folks' time. Turn it back to Xiomara to close us out.
Great, and thank you, Meredith and Laura, for answering all the questions, and thank you, ladies and gentlemen, for joining today's webinar. And with that, this concludes today's presentation. Now, please remember to fill out our post-webinar survey as you are closing out. Thank you for joining today's webinar.